meeting. Call the meeting to order. Have a roll call.
Hoffman here.
Hassett here.
Lane here. I would ask, if you haven't already done so, if you could silence your cell phones during the meeting, I'd appreciate it. Also, I would ask, if you can, to please stand, face the flag, join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. I would also like to acknowledge a few significant incidents that we're facing. This past week has been pretty active. We had, at the beginning of the week, the anniversary of October 7th and the terrible war that has followed since over the past year, and also Hurricane Helene and Hurricane Milton. Our hearts go out to the people in Florida and over in Israel and the Middle East that are dealing with all these things. So as bad as sometimes we see things here, things are a lot worse in other places. So just wanted to make a little acknowledgement as I watch the news and see all these other things going on. So going right into our business, the first item on the agenda is to approve any available minutes. Did you have an opportunity to look at that?
I did. I didn't find, I found them good.
All right, I did have a couple of comments. I just wanted to clarify under the line 68 on the second page. It says Ray Holmquist, who was also present, and noted that the building, designated as a stable. So it was designated as a stable on the plan, not by us. So I just, what's that?
On the plan.
On the plan, please, yeah. Because I just wanted to, because the whole topic of discussion about that was that it really is not a stable. And on line 69, it says, according to Chairman Lane, the building has not been permitted as a stable for several years. Not really according to me. I mean, I mentioned it. I did mention
I
it.
think it's according to the Board of Health.
Yeah, according to the Board of Health.
Yeah, that's the point I brought up.
Okay.
Yeah.
Yes, so that's, you agree with me.
Yeah.
Yeah. So it's almost like I'm declaring it not a stable, but it hadn't been, the point was it hadn't been licensed as a stable for 10 years. And Kathy had, I think what I said was Kathy confirmed that for me. So it should say according to the Board of Health. That's good. I just want to clarify that because 20 years down the road when someone's reading this, I want them to understand it.
You honestly think they will?
Just in case. That's what it's there for. And then on the variance request for 14 Maple Street, line 83, it says a barrier has been installed around the field. David, do you recall what they were referring to what were they referring to?
So the barrier has not been, it will be installed.
That's exactly the point.
Will be.
Yeah, will be, yeah. Yeah.
And that will be between the foundation and the field.
Yeah. Okay. That's all I have.
Okay. Around the field and...
In the cesspool.
And the
needs to be
cesspool?
filled in. That's correct, yeah. They haven't put the field in yet.
They have not.
Yeah. And the barrier's in the ground, right? That's what they're talking about?
That's correct, Rich, yeah.
Yeah.
Yeah, it was not clear to me.
Right, that's,
And it will be not the cesspool, but it will be field in the foundation.
And that's what I wondered.
Yeah.
Okay.
so what are we changing it to? Just,
Where is it? Cesspool?
Foundation.
It'll say foundation.
okay.
As you recall, the cesspool was in the basement.
Right.
That's what I thought they said, yeah. Yep.
Okay, how is it going to read? Just, Elaine, if you could read it back. How is it going to read first?
A barrier will be installed around the field and the foundation, and the cesspool will need to be filled in. How about that?
Yeah, okay. All right. Any other comments on the minutes? No? I'm good. Do I have a motion to approve the minutes as amended?
I move that the minutes be approved as amended.
I second.
Okay, I have a motion and a second. Any further discussion? Hearing none. All those in favor?
Aye.
Aye. Okay, our second item on the agenda is the agent report, but I'm wondering, we have two guests that want to present tonight. I think maybe we can skip to them if the board is amenable to that.
Fine.
Okay. Gentlemen, which one would like to go first? Don't fight each other over
You use some
it.
PowerPoint?
No, I'm not.
Okay. I just didn't want to interrupt, because it takes a long time for this.
I gotta come to work here again tomorrow, so if you don't mind me.
Absolutely, yeah, that's why I'm doing it.
You mind if
Yeah.
I pull up and share so we may
Not
have
at-
more of a discussion?
Not at all.
Okay. So I'm Steve Wallace, your town planner. I'm about to begin my third year here in Sterling. I've got 35 years as experience as a professional planner. Did 10 years in New Hampshire, 25 years down here. I was with Westminster for about 12 years before coming over here. I saw a lot of similar problems that facing you folks that face Westminster, so I thought I could help. One of the things that I wanted to do is take a crack at updating your zoning. It's out of date, it's difficult to read, there's a lot of confusing verbiage in there, and your permitting process for new development is disjointed and time-consuming. So I wanted to address all that. So the planning board and I have begun a 3-year effort to update your zoning bylaw. It's something that we're going to try to do in-house and save the town about $150,000, which is what you would pay a consultant to do it. But in order to do it in-house, we've got to break it into manageable pieces. So this year, we're handling all of the economic development aspects of zoning. Next year, we'll dig in on all the residential aspects of zoning. And the third year, we'll handle whatever's left. Your sign bylaw, your parking, what have you. So we're trying to do zoning amendments a little differently than they've been done in the past. We are getting them out there very early so that we can shop them around to all the boards, commissions, and committees and the public to explain what we're doing and why we're doing it. And that's why I'm here before you tonight. There's not a lot in the zoning that's going to impact the Board of Health, but as a courtesy visit, I wanted to let you folks know what we're pitching and why. We think this is a better way of doing it than the way it's traditionally been done. The planning board discusses a zoning amendment at one of their meetings. They have the public hearing. Maybe people come, maybe we don't. Then it shows up on the warrant at town meeting and people say, well, what the hell is this? What are they doing here? We want to get the word out early so that we can get the feedback from the people, make adjustments as needed, and then go to town meeting. So I'm making the rounds right now to all the boards, commissions, and committees. We're going to have a public forum on Thursday night, November 7th, right across the road at the 1835 Town Hall, 6:30, and that's where we'll present our zoning ideas to the public. What we're going to do, the planning board and I, in December and January, is debrief from all the public feedback we received, make the revisions that are necessary, have a couple more public forums to present the final result. We'll do that in February over at the 1835 Town Hall. Have our required public hearing in March, and then we bring the zoning amendments to town meeting. So that's the schedule. And right now, we've got 4 zoning amendments that are being sponsored by the planning board. We're going to sponsor 2 on behalf of the building department. And then we've got a couple zoning amendments being thrust upon us by the state and federal governments. So, with that said, I'm going to dig in on the amendments. So for economic development, that's what we're dealing with year 1. Folks have seen their tax bills the past year. We've seen how they've increased. And that's going to keep happening until you get some new economic development to help offset the increase. There's such a thing out there called cost of community service studies, and those are prepared by institutions of higher learning and civic organizations. And what they attempt to do is figure out how much taxes certain land uses bring into a town versus how much it costs the town to service them. So I've looked at over 275 of these cost of community service studies, and they all show the same thing. Economic development brings in more in tax revenue than it costs to service. Sometimes significantly more. Now, in 2009, the American Farmland Trust did a cost of community service study for Sterling. And what we found, or what they found was...
What year was it?
2009.
Okay.
And if we were to repeat that study today, it's not going to change very much. But they found that for every dollar brought in by economic development, it only costs the town 26 cents to service. So that's a tax winner. Residential development, on the other hand, for every dollar that brings in, it costs the town $1.09 to service. So, the first thing we want to do is fix the performance zone. Do you folks know where the performance zone is in town? Down in the south of town, along 140, right near the intersection to I-190, right over the border in West Boylston. Okay. That district is about 83 acres in size, and it still has about 25 acres left of vacant developable land. In terms of economic development, that is the town's most immediate opportunity. We've got the industrial area right across from Demola's Ice Cream? Neola's Ice Cream, thank you. They're going to be hauling earth material out of there for another 15 years. And once they're done, they're going to have a nice, flat, pad-ready site for an industrial park. But that's at least 15 years down the road. The performance zone represents your best bet for new economic development in the immediate future. So, right now, it's governed by 13 pages of confusing, contradictory language in the bylaw. Our proposal is to change the name of that district from the performance zone to the Gateway Enterprise District. Take away that 13 pages of gobbledygook, which if I can't understand and the building commissioner can't understand, how are we going to explain it to someone who wants to develop in that area? The fact that it's been on the books for 30 years and hardly anyone's used it That should be a testament that it's not very usable. So we want to do away with that 13 pages of bylaw language and treat it like any other zoning district in town. You put the permitted uses in the table of uses. You put the dimensional requirements in the table of dimensional requirements. All right, you with me so far? So this is the performance zone right here, Route 140. That's a nursing home. There's a cemetery. Those are the greenhouse properties. And you've got vacant land here, 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 and here. What we're proposing is to take out the 2 parcels that are owned by DCR, since they're never going to be developed. And we're going to take out the cemetery too. Apparently, the last time the planning board tried to change the zoning down there was a big hang-up about the cemetery, afraid that it would be developed for economic development. And even though cemeteries are permanently protected, no matter how they're zoned, if that's going to be a hang-up, we take it out. All right? And in terms of the uses that we're proposing out there, they are pretty much what we heard from the public when we had a couple economic development forums in March. They're looking for the types of development that are compatible with Sterling's rural character. So some of the new uses that'll be allowed there will be farmer food and craft cooperatives that produce products grown or manufactured on-site or off-premises, restaurants with or without outdoor patio seating, takeout but not fast food, no drive-in restaurants, antique shops are allowed, breweries are allowed, business or professional offices, studios for arts and handcrafts, artisanal manufacturing, printing, binding, publishing, and related trades. So those are some of the uses that would be allowed in this district. What people told us they don't want to see this developed into a strip like Route 9 in Shrewsbury. So we're not going to have fast food, we're not going to have drive-through this or drive-through that. So the uses that we came up with are geared more towards things that the people told us they want and fit with Sterling's rural character. So any questions on that one?
What about housing? Housing, like apartment houses?
This would allow a mixed-use development that would have retail at the bottom of it and some apartments above, but it's not intended to be a residential district. So there would be some apartments if someone wanted to build them, but it's not going to be for single-family homes or duplexes.
I mean, it's still good, apartments still can bring kids to the schools.
They do. Yeah, there's no doubt about that. So one other change that we're making to the table of uses that I think it's important to note. Right now, Sterling allows residential development in its commercial districts. Most towns don't do that. And the end result of allowing residential development in your commercial districts is the land in your commercial districts is being slowly eaten away by residential development. Right now, of all the parcels zoned for commercial, 42% of them are used for residential. So if that trend keeps on going, eventually you're going to lose all your commercial land, and if you want new commercial development, you're going to have to rezone some new areas for that. So we're proposing to eliminate residential development as a permitted use in the commercial districts.
Do you have a chart showing that? Not for us here, but when you do it for the public?
Yes, what I'll be doing is showing the table of uses that lists what's allowed and what's not allowed.
Oh, the 42% of commercial district that's now used for residential housing, do you have a map that's showing that?
I don't. I
Might
can
be a
have a
good-
map made up for
I think that might be a good idea to demonstrate how much income, as opposed to costs.
Yeah,
right?
that's a good idea.
And where it is.
Right.
Right.
I mean,
Well, the map would depict.
yeah. but I mean,
Okay.
Picture's worth 1,000 words, Steve. And that combined with, the difference in what it costs as opposed to what it brings in is.
Yeah, I think that's key to
Yeah.
note for the public.
So, I have other questions, but I'm going to save it for the public session because my questions aren't specifically geared towards the Board of Health. So
Okay.
I want to get to the crux of how is this going to affect the Board of Health?
Sure. I'm going to leave these zoning amendments with you tonight, and they
Okay.
are online on the
Yep.
Planning Board webpage. I'd like you to look them over and give them some consideration. And if you, as a full board, have some comments you want to offer to us, I'd like to get them by the end of November.
Yeah, actually, we have copies of them. David
Oh,
had
okay.
sent them out earlier. but-
And it just, as citizens of Sterling, if you've got your own questions, you can contact me anytime. I'll be glad to answer your questions.
Okay.
Okay, so that's the first zoning amendment. We'll move on. The second zoning amendment is aimed towards streamlining your permitting process.
And this
Right-
is what affects us, Board of Health.
No, I don't know that it does.
Okay, that'd be interesting. Okay.
Right now, if a project requires both a special permit from the zoning board and site plan review from the planning board, they're often spending 2, 3, 4 months getting their special permit from the zoning board, and then 2, 3, 4 months getting their site plan approved from the planning board. So that is a lengthy permitting process for new businesses. And there's been a few instances where the conditions imposed by the zoning board on their special permit conflict with the conditions imposed by the planning board on their site plan review. And then what do you do? In talking with town council and the regional planning commission, we think it makes much more sense that any project that requires both a special permit and site plan review get handled by one board. I don't particularly care which board does it, whether it be the zoning board or the planning board, but our proposal as it stands right now is having the planning board do it. So it's one-stop shopping for new businesses. Come into the planning board, they decide on your special permit first, then they move on to the site plan, and it's one-stop shopping with the planning board, one hearing, that's it. Questions on that?
If I remember, is this you let the other board know and you actually get together with the other board? Or is that, like we're getting copies of things to look at, you do that before you give them an answer, right? So the other board has an option to speak to it, whatever it is.
Well, the way it's worked so far is the zoning board issues their special permit first. We get a copy of that. So when the planning board has their site plan review hearing, they're aware of the conditions imposed by the zoning board.
Okay. But you said it was one stop, so they're not going to go to the zoning board, they're going to go to you,
No,
right?
no, they would
That's what's
come to us.
proposed.
That's,
Yeah.
we would change it up so that instead of getting the special permit first and then coming to the planning board for site plan, they come to us for both.
And what I'm saying is you're going to let them, the zoning board,
Oh, certainly.
that's what I'm saying, the communication from you to make it a one-stop, but they're still involved and get to say their 2 cents, is
Most
basically
certainly,
my point.
yes. Right now, every site plan that comes through the door gets distributed to all the departments. I know David gets sent the site plans. I'm assuming you talk it over with the board and share their comments with me. So that's the way it's been working right along. Questions on this one?
So, are you proposing any changes for the way that the Board of Health would be approaching these? Okay.
You're still netted into the review process when it comes for site plan review,
Yeah.
and that's not going to change.
Okay.
Okay. So we'll move on to the third zoning amendment, and that is having the planning board become the special permit granting authority for multifamily housing. We're pitching that simply because multifamily housing also requires site plan approval, so bring it over to us for one-stop shopping. From the zoning board to the planning board. Now, we may hold off on this particular zoning amendment. I've got a grant application into the state that would pay for the state's leading expert on open space cluster developments to come in and help us rewrite our multifamily housing bylaw. Our multifamily housing bylaw that's on the books right now, with its open space requirements, it is a de facto cluster housing bylaw. So if we get this grant, I would pull this one from consideration at town meeting, and I would have the planning board and the zoning board work with this consultant to come up with an open space cluster housing bylaw that we can all get behind. Questions, comments?
Well, I think the big problem you run into from the Board of Health standpoint with cluster zoning is all the septic systems are very localized, and that may or may not be good at a particular location.
Well, and that's why that's why you're netted into the site plan review process, and you can tell us just that.
If they don't fit, they can't build.
Yeah.
I mean,
That's the bottom line.
it's not, it's cumulative. I mean, you know, you're cluster here, they're not necessarily independent.
No, sometimes they have community septic systems, and you've got to
Yeah, that's true.
look at them that way.
That's true.
So you'll still be involved in reviewing the septic for multifamily, just as you are now. Okay, so the last zoning amendment being sponsored by the planning board deals with site plan review. Right now, you've got a site plan section in your zoning bylaw that gives the planning board the power to adopt a set of site plan regulations. But the planning board has never adopted a set of site plan regulations. Site plan regulations typically spell out how the process works for site plan review, what you need to show on your plan, what thresholds you need to meet to submit a traffic study or an environmental study, and design guidelines. It's been my experience that if a developer knows what your design guidelines are up front, they will build to them. But we don't have any design guidelines right now. So whatever a site gets designed to look like has been largely at the whim of whoever sits on the planning board at any given time. That's not the good way to do your planning. So we want to revise the zoning section that deals with site plans to pull out some of the stuff that should be in the regulations, and then we've got a set of regulations that the planning board would adopt if this bylaw passes. Questions?
They need the bylaw to pass to adopt their regulations?
Well, the regulations the planning board adopts, just like you adopt your own,
Yeah,
you do it at a hearing of your own, doesn't require town meeting.
right.
So this would be pulling a lot of the procedural stuff and content stuff out of the bylaw, making the bylaw simpler to read, and putting that content in the regulations. We would adopt the regulations if this passes.
Okay, I understand now.
Okay, so those regulations are just about done. I imagine I'll be able to post them online sometime in November for people to know what they're getting into.
Okay, now, I want to take a step back to the one before on the cluster housing. If we need a consultant, normally if someone comes to us, they're going to have to pay the fee for us. And is that still good? How do you make that happen if they're coming through you? But we have to ask a consultant because it's too many houses and we don't think they're going to fit, and we need a consultant because they may need, what do you call it?
That wouldn't operate any differently than we're doing it now.
Okay, it wouldn't. We'd still pay the consultant, and whoever was applying would have to pay for it?
Yeah.
Okay, but, okay, just because they're not going too
And
hard.
I'll be glad to coordinate
Yeah.
that to you. If you tell
Okay.
us that you need a consultant to review the septic plan, I'll handle you tell me who you want to use for that review,
Yeah.
and I'll handle the paperwork and making sure the consultant gets paid and all of that.
Okay.
Yeah, that's why I asked them the questions. Our process, Board of Health process isn't changing at all.
Okay.
No.
Okay.
Okay, so now I'm going to move on to the two zoning amendments being sponsored by the building department. Well, actually, the planning board sponsoring them on their behalf. Building department wants to add a bunch of new definitions for stuff we should have been defining all along. And they want to amend some of our existing definitions to offer a bit more clarity and guidance. So that's what we're doing with that one.
That all relates to the building department.
Building department,
Yeah.
yes. The next thing they want to do is make an amendment to the zoning provision dealing with accessory buildings and uses. They want to add a bit more guidance and clarification to that. Basically saying that there shall be no more than 2 accessory building/structures on the same lot, and that garages containing 4 or more bays will be considered commercial. All right, and now to,
What about an agricultural area, the garages, 4 or more bays? So, say, one
that
of
would
the...
be an interpretation of the building commissioner. If he
Yeah.
thinks they're bays for automobiles,
Or tractors, or farm equipment.
if they make well, we're a right to farm community, so if the
Yeah.
applicant can show that they're part of.
It just
the
may be
farming
something for
operation.
you to think of and clarify, where
Yeah.
we still have some fairly large farms in town, and if somebody is building a building to house their equipment, they may have 4 or more bays.
Okay,
Yeah.
I'll certainly talk to the building commissioner about that.
Yeah.
Next zoning amendment is making some revisions to our floodplain zoning. In December of this year, we expect that the Federal Emergency Management Agency is going to issue a new set of flood rate insurance maps for the town. Our last set of flood rate insurance maps are from 1982. So they're in need of update. But in order to use them and to stay eligible for participation in the National Flood Insurance Program, we've got to make some minor revisions to the zoning, our floodplain zoning bylaw. It's mostly modernization stuff and new design standards. It's still going to be enforced by Conservation Commission, so the administration and enforcement is still going to be the same. But that's what we're doing with that particular zoning amendment. Questions? And now the most popular zoning amendment of all time, the MBTA multifamily overlay zoning. Do you folks know about the new MBTA multifamily zoning law?
Painfully, yes.
Yeah.
Which number is that?
That's number 7
Okay.
with my list here.
When I went to 7, all I got was a map online.
What's that?
When I went to number 7, all I got was a map. I'll have to go back and check. Okay.
Okay, the bylaw should be up there. I will check on that.
Might have been used earlier.
Okay.
Quite possible.
So, the state legislature 3 years ago passed the MBTA multifamily zoning law. It essentially requires that every MBTA and MBTA adjacent community set aside an amount of land that would allow multifamily housing by right, as opposed to special permit the way we do it now. Sterling is considered an MBTA adjacent community because we abut Leominster. Even though the Leominster train station is 10 miles away, and it's a 10-mile drive for you to get there, we're still considered an MBTA adjacent community. So the state is requiring Sterling to set aside enough land to accommodate 156 units of multifamily housing. Now this is where you folks come in. At a density of 15 units per acre.
It's still subject to Title V, though. It
Can
says
you
it
make
right
that
here.
work, that kind of density work, without municipal sewer? No, you can't. Title V would indeed
Right.
be
Would limit that.
the limiting factor there. What happens if we don't apply? The state will sue us, just like they're suing Holden and Milton.
Have they actually filed suit against Holden?
I don't know that they have, but Holden has made it clear that they're not going to apply.
Yeah.
The Milton case is still being adjudicated.
Right. And there is some misinformation floating around about the lawsuit that Holden just was, I'll use the term successful in, where a lot of people think it was the state that sued Holden, and it wasn't the state that sued.
No, it was, I think it was a housing advocacy.
Yes.
Yeah,
And basically, the court said they had no standing to sue Holden.
right, and that's it.
And that's a lot different than Holden winning the suit against the state. And I just, because I've heard a lot out there, and I've been trying to clarify for people that that was not the lawsuit that may be coming from the state against Holden.
Yeah.
It wasn't the Attorney General that sued Holden, like the Attorney General is suing Milton.
Once the deadline passes for
Yeah.
adoption, state's going to sue Holden if they don't pass anything. So did the legislature make any type of accommodation for those MBTA communities that don't have municipal sewer? No,
No.
they did not. So,
Other than it says in there, it has to comply with Title V.
exactly. So this is not the first unfunded state mandate I've seen come down the pike. My philosophy with that is if my bosses, the select board, are going to direct me to come up with a way for the town to comply, I'm going to try to do it as easily and painlessly as possible.
Now,
So-
can I just interject?
Sure.
Because I have read the law several times. They don't put much restriction on where you can put it, other than if you are within a half mile of an MBTA station, you have to put it there. That doesn't apply to us, but there are no other restrictions.
No, you are correct on that. So the first location I looked at, trying to be a practical planner, was land over near the Northgate housing development, right on the line with Leominster,
Right.
because that's where Leominster
There are, I
has
think,
the
some
sewer
of our
line.
school children.
What's that?
The kids who live there, back in there on Sterling land, go to Leominster School.
And Northgate is served by Leominster sewer line.
Right.
And I thought, as a practical matter, well, if there's enough land still around there to accommodate the housing we want us to zone for, let's have that area zoned for this multifamily overlay district. We looked up and down North Row Road, and none of the landowners wanted to have that overlay district on their land, and we're not going to place it on someone's property if they don't want it. We looked at the land around Northgate, but the state said we couldn't use it because it's only access from a road that falls within Leominster.
Right.
Okay.
So I said to the state in a conference call, so instead of putting this district in the most practical place where affordable, where this housing is likely to be built, you'd rather have us put it in an area of town that has no municipal sewer, where there's only the theoretical possibility of building at the density you require. And their answer was, yeah, you only have to zone for it. You don't have to make sure it's built. You only have to zone for it.
Okay. So I was going to save this for the public session because it has nothing to do with the Board of Health. But the state owns fully more than 1/3 of this town. Why couldn't we zone some of their own land? There is nothing in the law that says we can't do that. They're trying to put their mandate on us.
That's a very interesting idea. I never thought of that quite.
They're trying to thrust their mandate down our throat. How about having them put their money where their mouth is and zone some of this DCR land?
Oh, no, that's watershed protection land.
But there's nothing in the law that says it's zoned something right now, right? Every piece of property in this town is zoned something.
Yeah.
Then we rezone it MBTA overlay district or whatever it's called.
Yeah.
You know, state, you want to do it on your own property. Don't take our land from us.
Okay.
Just throw that out
That's
there.
an interesting idea. But we did find someone in town that was willing to have this overlay district on their property. So I'm going to show you where that is.
Oh, I've seen
And
it.
talk about it. A gentleman at the end of Ford Road who owns 60 acres, right in the very northeast corner of town. That's the property right there, 60 acres, right at the end of Ford Road. He's up to having his property rezoned. So this is a close-up of the property. I guess there's an old Boy Scout camp near this pond there somewhere. So, 60 acres. He plans to take out 20 acres to have 2 estate lots. One that he's going to build and one that will surround the house that's already down in this vicinity at the end of Ford Road. So that leaves 40 acres. Now, the state tells you what you need to put in your overlay district bylaw, but one of the things that the town can do is set its own dimensional standards and its own open space requirements. Just as long as you can theoretically achieve a density of 156 housing units. So our bylaw says 75% of that land needs to be set aside as permanently protected open space. So 60 acres minus the 20 that the landowner wants to reserve for himself leaves 40 acres. Protecting 75% of that 40 acres leaves 10 acres. Practical impact of Title V, no more than 4 units per acre. And that's if the soil is very good out there. 4 times 10, the real impact at most would be 40 houses out there, 40 multifamily housing units. Questions? You understand how I got there?
When you say multifamily, 40 units, how many families to each unit? Yeah, I mean,
One per unit.
just one per unit?
Yeah.
So we don't need the 156 with that? Okay.
Well, you're never going to get the 156 unless someone runs the sewer line down there. But you've satisfied the state requirement of theoretically zoning for 15 units per acre. They'll be happy with that. They've told me that. You've got it in there, 15 units per acre. They know full well that no one's going to be able to build at that density without a sewer line out there. No sewer line's ever going to go out there. It's going to be governed by Title V.
How far are they, I mean, I know where the land is. How far are they from the limits of sewer lines?
It's Jungle Road across 190.
Yeah.
I would guess a good 3 miles. You've got $5 million to extend that sewer line
And go underneath 190.
and go underneath 190.
Ain't gonna happen.
So,
Although there is a tunnel under 190. So there is a tunnel over there. Yeah.
so Title V is going to apply to that area, and that's a practical impact. You would expect no more than 4 units per acre. 4 times 10 is 40 units. Questions, comments?
You got my comment.
I am
I think
certainly
it's a great
going-
idea, too.
I'm certainly going to share that with the powers that be and get their take on it. Folks, thanks for making the time for me. If you've got any questions or comments that you want to offer the planning board on this, I'd like to get them by the end of November.
Yeah.
Please come to our forum on November 7th, and the forums we'll have to show you the final product in February. Thanks for making the time for me.
Thank you, Steve.
Thank you, Claire.
Did you invite the state rep and the state senator to come on November 7th?
All right. We're going to continue with the meeting. You guys can talk out there if you'd like. Barry, come on.
Good evening. I'm Barry Lane. I'm a 4th generation Sterling resident. I have a couple of handouts that we'll get to halfway through the presentation, but I don't want to get up again.
Thank you.
And we'll explain what that's for. So I've been providing the Board of Health with public health emergency preparedness consultation since about 2006. And I've got a presentation here to show you what all is involved with that and to help clarify some acronyms. We have a bunch of alphabet soup out there. And there's a bunch of different agencies that provide different kinds of public health support. And we'll look at those at a regional and local level. So the first thing, this organization is where I started after I retired. FEP, it's the Public Health Emergency Preparedness Coalition. And it's in the Department of Public Health's Region 2. And we'll see that that's kind of Worcester County, but not. So we'll show a map and see how that's different. And then we'll get into Sterling's emergency preparedness preparation and what we've been doing all along and how we can cope with things like the COVID experience. So this is the agenda. We're going to look at who is FIP, what does FIP do, what other regional efforts are there, and look at Sterling's emergency preparedness capabilities, our plans, our equipment, our supplies, and our personnel. So this is Worcester County. And as you can see, that Region 2 is a little bit larger than Worcester County. I don't know how the Department of Public Health decided who was going to be in here. I think the towns volunteered to be in this region. But in the Four Corners, it's a little bit larger than Worcester County. And there's us right there in case you missed it. Okay, the Public Health Emergency Preparedness Coalition. It's comprised of representatives from 74 local public health departments in Region 2. That was established in 2004. It works on joint initiatives related to public health emergency planning and response, including fulfillment of public health grant deliverables. So it's funded through the Centers for Disease Control and Prevention, from a grant to the Massachusetts Department of Public Health Office of Preparedness and Emergency Management. So the money comes from the feds to the state and then gets dispersed to the regions, which then different regions work it differently. So at one point they just gave cash to each Board of Health. Region 2 never did that. And we're the largest region and actually the most proactive region as well. So the FEP mission is to protect and prepare Region 2 by developing the capacity of the local public health system. It's to build resilient communications throughout education and preventive efforts, to respond to bioterrorist events, infectious disease outbreak, or any other public health emergency. To support the needs of the most vulnerable and to sustain a continuous preparedness program. So as Steve mentioned, this is another unfunded mandate, but don't get me started. The membership again is an email distribution of 74 communities. They receive the minutes and the agendas. Fewer people actually participate in organizational activities. They're called the steering committee. And those may be 40-ish people, depending on whether it's a Zoom meeting or an in-person meeting. Most Board of Health members have day jobs, so most FEP participants are health agents or directors or town health nurses. And a few regular participants represent 2 to 6 towns, so some of them work in multiple towns, especially the town nurses. And then there's people like me. If a town makes a request for funding for some equipment or supplies or services, a representative has to appear to justify the request. We don't request a lot of stuff from them, but if we did, myself or David or one of you, whoever chose, would have to go to the meeting and say, this is why we need it. Let's see. That's, yeah, these meetings where they have to attend is when we see new members. Come on. There used to be public FEP consultants that were assigned to each town, multiple towns. That's been cut down to like one person now. But they provide services such as assisting with and documenting after-action reports for annual drills, setting up mock clinics, and testing the EDS plans, emergency dispensing site plans. The one planner compiled a list of possible ancillary agencies, such as all the faith-based agencies in the community. CERT is Community Emergency Response Team. community or citizens? Anyway, we do have one here in town.
I think it's civilian.
Civilian?
Civilian emergency response team.
Yeah. MRC is a medical reserve corps, and we'll get into these later, and other groups. Let's see, and they help with creating and updating the EDS plan templates with annual updates to sometimes a singular section of the plan for all 74 towns. So we have a big plan, we've had it for years. The state used to keep saying, well, take this part of the plan and update that, and take this part and update it next year. Now we have pretty stable plans, so there won't be so much continual updating, just when like board members change or people at the schools change, like the principal, who are you going to contact at the school? Well, we just lost one principal and got a new one, so those kinds of things will be minor changes. And an annual work plan guidance comes from FEP through the state and the Mass Department of Public Health, who gets direction from the CDC. So it all comes down the chain, so, you know, who knows, it could be totally different next year. In our area, some steering committee members include Jeff Pastor from the Board of Health in Lancaster. I don't know if you're familiar with him. Tom Bocci from, as he's the agent in Clinton. Me or Jack, I'm going to be talking to you about transitioning my duties to Jack Chandler. Phil Legere has multiple towns out in the Townsend area. Sometimes a rep from the Neshoba Associated Boards of Health come to the meetings. The southern part of the region sees more participation than we do up here in the north, because that's where the most people are that get involved on a monthly basis. I've been Sterling's designated voting representative to the FEP steering committee. Well, maybe it's 2008, who knows? It just seems like a long time. I'm trying to transition your consultant to Jack Chandler. I don't know if any of you know him. He's been the deputy chief in Sterling Fire Department, also retired as fire chief in West Boylston and in Holden. So he's got a good background in emergency preparedness, and I've already had him shadowing me for a little bit, and he has subsequently said that he would be interested in taking over for me. I'm getting too old for this, especially these late meetings. Okay, so they want Board of Health members on their distribution list. You might receive emails from different individuals, as we'll look on the other slide. And so far, Dave and Kathy and I have been responding to their requests from FEP. So on your paper here, these are 4 things that we need to update people's contact information. And there's one sheet there that you can put that information on. But from Worcester, you'll be hearing from different people. One is Alyssa, and she's the chief of the Office of Health and Medical Preparedness for the Department of Public Health at Worcester. And then there's Pamela Masters. You might receive something from her. Chelsea Orifice also is with that office, and most of the time these are things that David and I would respond to, but you can take a look at it and you can decide if you could even become your representative to their organization. So what we're going to be doing when I get your addresses is I'll send your addresses to Pam, Chelsea, and Alyssa to put on their distribution list. Then the third bullet item on your sheet here is the HAN, the Health and Homeland Alert Network. All new Board of Health members should be listed on the HAN to receive health-related emergency notifications. So this is a state system. And it's split up by towns, so you get associated with a certain town, but then the distributions are set up, so it could be central Massachusetts, all of the state, but you're a subsection of all of those. I haven't seen anything in my years here that came out just to a single town, or at least to Sterling. So it's more notifications, like, I don't know, there's triple E in your neighborhood, okay? So that's a larger geographic area, but they need the names on that list. I have not seen where I can add these names, so I think there's going to have to be something coming from David, maybe, since he's already on that list, that'll give them your names. But then you can go into it and tell them how you want the information to come to you in your profile. So you may want it to come right to your cell phone if it's a severe, urgent message. If it was just about, there's mosquitoes around, you might only want that to come to your email. And then there's combinations in between that too. But we'll send you a notice of when that's ready for you to go in and change your profile, and there'll be instructions. Any questions? Okay. And we'll get into the other two in a few minutes. Well, the last one, the EDS plan, right now I will make changes on the call-down list for our EDS plan. So when we have an emergency, we just open it up and say, these are the people who are going to call. So it's all you people. It's the select board, the fire chief, police chief, DPW, schools, whatever needs to be contacted is in our plan. So some of the regional agencies, we had talked about the HMCC, the Health and Medical Coordinating Coalition. This is the one that I told you is out of, it's hosted, well, they have a term for it. The funding goes through Worcester Department of Public Health. Then we have the Neshoba Associated Boards of Health, the Central Mass Regional Public Health Alliance, the Montechusett Public Health Network, the Leicester Regional Public Health Coalition, and another term you might hear is Train MA. That's where you can go and get any of your training that you want, either in emergency planning or in straight public health, so septic and whatever. And then we'll talk about the Medical Reserve Corps. So the HMCC, there are 6 of them in Massachusetts, and they're kind of like an umbrella over FEP. They're made up of healthcare organizations, including the local public health departments, but also including EMS, hospitals, community health centers, long-term care, and public health, so boards of health. The city of Worcester is the sponsoring organization. That's the one I was trying to think of. And the purpose of it is to align emergency planning throughout all those agencies, throughout the whole region. So the core representatives are the 74 public health departments, 10 acute care hospitals, of which there may be fewer now, and hundreds of other healthcare related organizations, including community health centers, long-term care, and EMS providers. The Central Mass Regional Public Health Alliance was started with a grant, and what it is the towns of Shrewsbury, Grafton, West Boylston, and the city of Worcester got together, and the city of Worcester provides all of the public health services for those towns. So we've probably heard the term regional public health agencies. Well, this is one that was started, and it has changed because some towns have wanted to drop out. but they provide the same stuff that this Board of Health provides, but to all those towns. And we'll just skip through their mission, but here's where they are. So they're the green towns there. And then you realize that we're part of the Montechusett Public Health Network. This is a little different. It doesn't provide all the services, but it has people that can provide inspectional services, nursing services, but they have a cafeteria type offering where we pay a fee like Costco. Okay, you can belong to this organization, but the fee doesn't get you anything more than just belonging. And then we can order different a la carte services.
I don't think they're doing any septic system stuff right now.
Maybe not.
I don't think so.
So these are all the members, which include Sterling. So it's the northeast section of the region. And you can see there they are. So it goes down to Clinton. And then you've got the Neshoba Associated Boards of Health. And I didn't realize till I was putting this together, they were started in the 30s, the 1930s. So these are all the towns that belong to that. And they are like the first one where they provide all the services, although they can be a la carte if that's what you want them to be. So Lancaster is the closest one to us that has that service. And they're up in the northeast. Now, this is a brand new one, the Leicester Regional Public Health Coalition. And they also, out of Leicester, provide full services to all these towns. Okay? But they're a little spread out. They're the yellow ones. So you get Holden and Leicester, and then this strip going through the boonies. We have Medical Reserve Corps, 3 of them in the region. It's a national system, but it's run on a local level. Involves in assisting during emergency that impact the health and well-being of the community. But MRC volunteers are trained and prepared to respond to emergencies locally. They function as part of their local emergency preparedness teams. They also provide education, outreach, various health services throughout the year, result in a collaboration effort to prepare for a large-scale public health crisis. So volunteers from this group have helped us at clinics. They were primary volunteers in the Rutland clinics you've heard about with the COVID. And Sterling has maybe a dozen members of the Wachusett Regional, the Wachusett Medical Reserve Corps. So we're representative quite well there. 3 of us are on their advisory board. But besides responding, they also are proactive in health services and work on grants throughout north of this area. So there's a Greater Grafton MRC down in the southeast. There's the Worcester Regional MRC, which is kind of weirdly shaped. It goes up to the northeast and down to the southwest. And then our own Wachusett MRC, which again goes over to Clinton. Train MA is a gateway of a catalog of public health training. It's part of a larger train learning network. And if you want to look at this, there's a website there, but it has and it's all free. It's all kinds of training. So any questions on those regional things? Okay, we'll take a look at Sterling responses. So we have an emergency dispensing site plan. And I have a whole other presentation for that, but we won't go into the details tonight. An emergency dispensing site is usually a location where medications or vaccines intended to prevent diseases may be given quickly to a large number of people in the event of public health emergencies. So we did this with COVID, and back in 2009-10, we had the H1N1 clinics as well. Many people have been exposed to infection that may make them sick, so we can either provide medication or vaccines if the spread of an infection is imminent or dangerous. So let's say there's a disease spreading at the Sterling Fair. Okay, that's something we would have to address. So we would do these things to prevent further spread of infections as well, so prophylactic medications. Usually responding to emergency dispensing site approach would require more medical and support staff than we normally have in Sterling. So the Sterling Board of Health would call on the local Medical Reserve Corps and other organizations, including the Sterling Fire Department. So we have a working relationship with a lot of different departments, and they're all on our call-down list. FEP has regional assets strategically placed around the region. They have 21 satellite phones that we test quarterly. They have advice, and Sterling has one of those phones. We have an advisory AM radio stations, so Sterling has one of those as well. And so we can set up that people can listen to it in their car radios, at home if they have AM at home too. But usually it's a car radio, because if you lost power and stuff, you probably wouldn't have your radio on at home.
What's the call number?
I think 1630. I don't remember. But there are two around the 9 radio stations. There are 2 different call signs, and we split them up so that 2 won't be right next to each other. I'm thinking 1060, but I'm not sure. There are also trailers and equipment. There's 14 of them spread out. We do not have one of those. And just recently, like 2 weeks ago, we received some language translation devices. So we have 3 of them, and I don't know how many there are in the region, but these you can talk into and pick a language, and it speaks the language back out. So we can have these in a dispensing site and talk to people who are using different languages, and it doesn't require a connection to Google Translate. So if you don't have an internet connection, this is all built in. Locally, we have things like canopies, tables, chairs, a lot of signs, logistics. We have agreements with the schools to use the schools or their parking lots. We had our last COVID clinics at the senior center. Churches are available. We have boxes of emergency response supplies, so gloves, masks, sanitizer, dispensing supplies, and operation supplies. And this is just an indication that we've got, on the left-hand side, you can see that we've got black boxes and orange boxes. So the black boxes go to the logistics section of the clinic or the EDS, and the orange ones goes to the medical side. So it's all set up. In the middle tells what's in each of them, and on the right are comments, and it tells you when they're deployed. So, for instance, orange box number 1 is always deployed because it's personal protective gear. And then orange number 2 is always dispensed. It's for the first 500 people that show up. And then we go on and on. So, before the state even, well, the state has to send us the medications, but we do have some supplies if they're a little bit behind. So the emergency personnel can respond. We have the Board of Health, of course, some town staff. We have the fire department and EMS, if they're not off doing their own stuff too, because if it's a big incident, they may have things that they're doing adjacent to it. We have the school and senior center staff, the Medical Reserve Corps, CERT, and other local volunteers. And here's a picture of a motley crew after one of our drills. So here, all those people are represented here, except for the school. He didn't want to get involved. So during COVID-19 elder clinics, the fire department was the primary lead because the medications came through FEMA and then MEMA to the fire departments or to emergency management, as opposed to CDC, public health, and the town boards of health. The vaccine provider was the Rutland Fire and Board of Health. The Sterling Center was the Sterling Senior Center was the venue, and they did patient contact, so they scheduled people for different times, and they also coordinated those people, and they were meal support for the staff, and then we had volunteer support from the Wachusett MRC, Sterling Holden CERT, and Sterling Board of Health volunteers. So we did an outdoor clinic, which was one of the first ones in the region. And we did, the first one was covered in snow, so the DPW came out and got all the snow away, and we had little tents and everything. So any questions? No? Well, thank you very much for your time.
Thank you, Barry.
Sure. Now we need to figure out how to get out of here. There we go.
You filled this out.
Okay, thank you. I'll pick that up on the way out.
Okay. All right. David, you ready? We'll go into the agent report.
Sure.
Okay.
Just wanted to update the board on a few things. We've issued 3 certificate of compliances for completed septic system component repairs for the month of September. We've done 2 food inspections. 2 food inspections. We've issued 1 well permit and separately 3 construction permits for different addresses with septic systems.
Okay.
One other thing that I've been working on with the Massachusetts Public Health Network is they have a goals and a grant for goals specific to providing a consistency with forms. So as you may know, not all towns work on the same forms or so forth. So they've asked us, along with the other 11 or 12 different towns, to collaborate and work with, share them with them what forms we use so that they can bring everything together. I've submitted 3 different forms, 3 different addresses with forms that we've used, from Title V inspection forms to soil evaluation forms to construction permit forms. And they've also asked for 3 separate food establishments so that we can share with them what forms we use along with the other towns so that we can all be on the same form page. The flu clinic, October 23rd. It will be from 9 a.m. to 12 noon at the senior center. Rabies clinic, Saturday, October 26th. Cats, 12:30 to 1:30. Dogs, 1:30 to 3 p.m. And that will be at the VCA over here on Clinton Road. Town Administrator Bill Cadwell has been working with the Collins Center at UMass Boston to kind of put together a new, speaking of forms, new way that we're going to be documenting and recording our annual report and incorporating that with our budgets. So it used to be that our annual report would go out in a book, and it was kind of, all of the different reports were a little bit, this will be more formalized and formatted consistently.
Is that what this document is in our book?
What does that one say, Rich? What number are you at?
That's the one you had number 2, David.
Yes. So we're going to have to take some time to look at that, if you would. I can send that out electronically to you all as well. Take some time to look at that and see if there's any input that you may have with that. Last thing I wanted to update the board with is we've had some trash complaints. I forwarded some voicemails. Rich, you and I have looked at the other addresses. Some of the 2 out of the 3 have been found to be a non-issue. No justification as far as the concerns. The other one I've spoken to the homeowner on. I've not seen a lot of movement there, but...
No, not since the first weekend when the cardboard was cleaned up, I guess. So,
I mean, that one there, there's various different things there. But Rich, you have seen that as well.
Yeah, I've been past it several times, yeah.
So what's our next step?
That we need to figure out. There is no clear template on how to handle these things. I mean, it would be a different story if there were a lot of rodents around or something like that. There is junk in the yard. There's a mattress and box spring in the yard. And you try to get the people to clean it up, but at what point in time is that we take official action? There's nothing clear, there's no bright line on it.
Well, should we set a line? You know, we give you, if something like that's going on, you get an official notification, and if you haven't done anything in, say, 2 weeks.
So I think that's easier said than done.
Yeah, I agree.
So they have a box spring in their yard, and I have a big pile of old firewood in my yard. You know. Go ahead.
Well, I mean, there's a difference. It's not illegal to have a messy yard.
That's true.
And so you gotta be pretty cautious on how you approach this.
Yeah.
What is the public health aspect of this? It's not I mean, we're not the Merry Maids of Sterling. And so, you know, and a messy yard doesn't necessarily result in action from the Board of Health. So you got to be pretty concise in if you're going to cite them, what are you going to cite them for?
Right, that's why I said if the yard was full of rats and stuff like that, that's a different story.
Or food or
right.
things like that. Or maybe being, well, I'll just leave it at that.
Yeah.
But these are my experience has been, these are very tough, it's hard to draw the line. If it's endangering anybody's health or it's the rats or even just animals. Those are things you can cite, but you got to be specific.
That's what I was saying. It's not really a bright line.
Okay.
I think we need to continue to monitor and continue to. This is my opinion, and the board can weigh in. But I think we need to continue to monitor and continue to encourage them to clean up and watch for the other things that might arise, and if so, then we take action on that. But again, it's messy, but I've seen messier yards too. And
So is it, sometimes it can be a factor that the people don't have means to take care of it?
I can imagine that's one factor. Sometimes people just don't care.
Yeah, that's true, and then there's those that don't care. Okay.
I don't know what the factors are here.
I don't either, but I mean, the mattress, I see there's a car there, a small compact car, so.
Is it unregistered?
No, it didn't look like it was unregistered.
Okay.
But, again,
Because, the unregistered car then, so it's not ours. I think isn't that the building? It's somebody else's.
The zoning
regime,
enforcement
but-
officer, but I believe you're actually allowed to have an unregistered car on your property. So,
but I will continue to monitor it and follow up.
I have some experience, I don't know whether it's worthwhile. I'd be glad to take a look at this.
Sure.
With you.
yeah, I was going to say go with David.
Yeah, sure, I'd be glad to.
Yeah.
We can do that.
We try as many different angles as we can.
Yeah.
So I agree with that. Okay.
That's all I have for updates.
Okay. Alan, do you have anything further on Triple E and West Nile?
The state, as of this week, has ceased reporting for the year, so that's really in the past, so there's no more reports, and you still have to be a little bit careful because there are mosquitoes until the first frost, but I think the public health issues are essentially over for the year.
Yeah. Okay. Does anyone have any comments on the installer's exam, which we put off from last month to this month? You should have all gotten a copy of the two different installer exams.
Well, we were talking with Dan Kropaska. He said he would be happy to look at it. Did you have a chance to send it to him?
I did not send it to him.
Okay.
Okay.
I was under the impression that you would be sending it.
All right, so I do have a couple of comments on the exam. One thing, over the years, I've put many exams together in my different roles. One thing I always like to do with the question is to put the site down with the question. In other words, question 1, 15, 24013, whatever. So there's no question that this came from Title V. Sure. And I did, because one of my concerns was that we might have questions from our old set of regulations. I went through each question and I looked up the site for each question. They're all from Title V. None of them are from our old regulations that are in place. So these exams, as far as I'm concerned, are good that way. So we're not asking someone a question that doesn't pertain anymore. There are just a few cleanup things that I have. We can make copies of my notes if you want.
Sure.
I would like other people to go through them as well, because I can make a mistake, So I went through each question. I looked for where it was located in Title V, and I put that site down with the question itself and the answer there as well. So if you guys haven't had time to do it, I think it's something that we need to do and just clean it up a little bit that way. So with that, I guess we will continue this as well. And in the meantime, I'll give these to David. He can make copies.
That would be good.
And email them to you.
Sure.
So there's two different exams. Some of the questions overlap, some of them don't, which is fine. There are some cleanups here, like use of terminology. If we're taking a question from Title V, we should use the exact wording that was in Title V, like permitted as opposed to licensed, things like that. So I made those cleanups. But again, the more eyes on it, the better before, and then we finalize it, and this should be done every couple years. So I guess as far as that agenda item goes, we'll continue it on again, okay? So the next thing on the agenda is the comprehensive policy review and update. I did not get any input, so I put together a starting point for our policies.
Isn't that this? It's
That's the-
it's in number
It's
two
with
in mine.
David's thing, yeah, it's under number 2. It was put in under David's. So, again, this is a draft, this is a starting point. So if you have comments on it, we can certainly talk about it. If you haven't had a chance, that's not it. That's the other document.
This one,
Right, from there backwards.
I looked
I
at
didn't
this.
realize that, sorry.
No, that's fine.
No, I did look at this.
Yeah, because you got it on your email, too.
Yeah, right.
So there is a section that we've already agreed upon, and that's section 7, the septic installers. I just took that verbatim from what we have already agreed upon. So that's something that we really don't need to look at.
Yep.
I went off a template that the Massachusetts Association of Health Boards put out. So if you see all these, like nuisance and lead paint, I took that all from their template and it's just a documentation of this is what we do. There can be other things. For instance, one thing that Dan Kapaska mentioned that we don't have anywhere is tattoo parlors, which is something we're going to need to look at, I think, at some point.
Yeah.
I'm trying to reconcile, I did have a couple comments, I'm trying to reconcile with what you're looking at.
That's the same thing. Yeah.
Yeah, I had a couple of comments here. This is the same one, right? Same stuff?
No, that's those are the minutes there.
Oh,
Yeah, those are the minutes
Yeah. This is,
with the blue line on the bottom.
yeah, I mean, there's a couple of spelling things, and you can kind of like down here. And you've got 2 different names here.
Yeah, Massachusetts Association of Boards of Health.
Yeah, and you got
10%.
10 and 15.
That's exactly why we need people to look at it.
10 and 15%.
Which one is that under? Well, we need to talk about that for
Yeah,
sure.
yeah, I mean, but there are,
Yep.
I think it's well organized, but I mean, I think there's some things that still need a little work.
So the variance issue, which you pointed out, is a disconnect between
What page you on?
I'm on page 2,
Okay.
letter F.
Yep.
Have not heard back from the DEP contact on that, but I know she's very busy, so.
And did you catch this one?
Yeah. Something didn't get transferred over, right?
I
There's little gremlins in your computer.
Yeah. I must have hit carriage return here.
Oh, this says, I always use my middle initial.
Okay. Yeah, we're far from there, but that's good.
Yeah.
I'll make sure it gets put in.
Yeah, no, if it's a formal document, I usually.
Right. So it is getting late, so I don't want to exhaust this. This is something that everybody can look at more.
Yep.
And if you have,
I have some comments, so.
Yeah.
About renovation?
variances, F?
Yeah, I know. You have 20% for renovation. I think if someone's adding flow to their house, they shouldn't be, if some, I mean, you just think, take someone that has a 2-bedroom house, they're gonna go up and they get a 4-bedroom house. They shouldn't be able to get that. They shouldn't be able to have, manifest injust because they're making a bigger house on a lot that doesn't, on a septic that doesn't support it. I don't agree with manifestly unjust for that, and DEP says no. Dan Krapaska said no manifest unjust for new construction at all.
That's not true, though.
And we
You
have to-
have to read through.
Okay, that's what he said.
Read the whole thing.
Okay.
And that's not what he said either. He said, unless they can prove, right, that the applicant demonstrates that without the requested variance is denied substantially all beneficial use of the subject property. That is specifically in Title V.
Okay, so
But the
I guess
conversation was, how could anyone prove that they couldn't use the property?
Well, okay, so if it wasn't an existing, my issue is it's one thing if a property burnt down, that's different.
No, that's not what we're talking about.
Okay, but someone that's buying a piece of land, and now he wants to say manifest injustice, well, don't buy the piece of land.
Yeah, I had the same, I
Okay,
didn't mark
don't
it.
buy a piece of land that you're gonna try to tell us that you can't meet Title V on, when you know you can't, because you're gonna go to this, and that's not right.
Well, he would have to prove that without the requested variance, he's denied substantially all beneficial use of the subject property.
But that was just, he bought it in the first place.
Yeah, this is,
You know, don't buy a piece of land that you can't use for what you wanted to do and then expect the town to make an adjustment because you want to. Tell me, you really think I'm wrong?
Yes.
I
Yeah.
don't. Every builder will be buying every little piece of property and say, manifest adjustment,
No.
I can build this and I can build
Listen,
this.
they
On a
can,
real piece of property, it doesn't get a variance.
No.
They don't get variances.
No.
unless they can show that, this is what Title V says. Listen, we don't have to put it in here.
Okay, good.
yeah.
I'm not saying I started this conversation off saying, nobody sent me anything.
Yeah, no,
Okay?
okay, yeah.
Nobody sent me anything. So I had to start somewhere.
But once I saw it, I can't call you and say something because I have to wait till the meeting because I can't do that. Otherwise I would have. I know that's against the rules, so I have to tell you at the meeting,
You can,
right? I
you
mean,
can, as I said in the email, you can send me suggestions, but we can't go back and forth on it.
Oh, okay, I didn't.
That's
I
exactly what
missed
was
that
said
part.
in the email.
Because I thought we couldn't, I just figured
You
whenever.
cannot deliberate between.
Right,
You can say, I suggest this.
okay.
And then I would put it in here and say, this is what I put in, this is what Gail put in, now we can discuss it.
Okay.
But I needed a starting place.
Yeah, no,
So
listen,
I
you
went-
did a great job. I'm
Okay,
not-
so I went to Title V,
Yeah.
and I put in what Title V said. If we don't want to ever consider manifest injustice for new property, that's not what was said to us, though. But we can do that as a board.
Well, I don't know what was said to you, but where I flagged was giving the percentages. I
Yeah.
think that, it says here, I'm on page 3 here, top of page 3, I
Yeah.
think it's not the only, it's the first sentence. It says, it's manifestly unjust when costs exceed 20%. I understand the manifest injustice, but I think when we tie it down that, well, is it 20%, is it 19%, I think you just should leave that kind of determination out.
Well, it was highly recommended to us that we don't leave it subjective.
Right.
Because that's what opens the town to lawsuits. So this would be a definitive, Alan. So actually, it sounds like neither one of you even want to consider it for new construction, so we can mark that one right off.
Okay.
So really, the only one that you would consider is so Gail,
Yep.
for renovation that proposes increased flow, the Board of Health may consider the financial burden manifestly unjust when costs exceed whatever we want to put.
Right.
But you're thinking that if somebody is putting an addition on their house, that
And the septic, and they don't have place for the septic
it's
system.
not what it says, though. It doesn't say they don't have a place for the septic.
Well, the manifest injustice is so that you could put less of a septic and get the reduced on Title V. Am I misunderstanding manifest adjustment?
Manifest injustice. So if you could put an alternative system on that property and still achieve what Title V wants, as opposed to putting a traditional system in, that would be one thing.
Right. And that would be okay.
It would be okay. But what if they can come up with another system, like a innovative alternative system that costs way too much? I just tried to factor in everything.
Yeah, I have a problem with the number, putting in a number. Just leave it as manifest and just.
Well, how do we, again, Alan, this is something that the DEP said, you really want to write down a number. Their number was 15%. I just wanted to hear it from Claire's, I can't remember her last name, but from the DEP. Yeah, Golden. She's the expert, and I haven't been able to get hold of her just yet, but they highly recommended that because that's a number definitive. So and what you do is you go by the assessor's value, and I asked them that directly. Where do you get the value? Is it the real estate value, or is it the assessors? And he said you absolutely have to go with the assessors. And that actually says, that's part of this paragraph, section F, in the last bullet point. Actually, the last paragraph, the person requesting the variance shall obtain a statement from the Sterling Board of Assessors documenting the value required in the above paragraph.
She's 15% excess, okay, and then we scratch the new, right? We all agree with it.
Well, I don't agree with it, but you guys do, so it's two against one. And that's the way it goes.
I definitely oppose the word new. The financial cost.
It's almost essentially impossible to do this.
I think it is, but
Right.
I mean.
That's fine.
I don't think we should be in the business of, on new construction, saying what variances we will grant. Our policy ought to be, you listen to what you have to say.
Okay. Well,
And then on repairs of the assessed value, I'm okay. I think I'm okay with taking, if we take the word new out. It's 15% assessed value.
Is he on you on the first bullet point?
what page are you on?
The big one I got is on page 3, the second word at the top.
No, we're taking that whole bullet down.
Oh, we're going to take this all out.
Yes.
Yeah.
Because that specifically,
That's for new construction, right?
Right, we're
gonna
taking
take
that out.
Okay, I guess I missed that part of the discussion.
well, neither one of you agree with it, so.
Well, okay.
Taking it out.
Okay. Then on the other one, I mean, see, I'm not privy to what was said.
Right.
This was reviewed.
Actually, I've been told that several times by the DEP, including the seminar that I went to in February, where they said you need to have, every Board of Health should have a point where they say, okay, this percentage. And the number seems to be 15%. Even for whatever reason, I wrote 10%, and then I wrote 15%. So I think 15%.
So that's 15% of the assessed value.
Yes.
Let me read this again. For repair of an, so.
So how do you feel about renovations?
So that's, the first bullet is for repair.
Yeah, I don't have a problem
The
with that.
second bullet is for renovations. So you got to think of all the scenarios, especially in this town. Because you have a family, they just went, had 2 kids and they just had twins. I got to put another bedroom on my house. That's going to cost a lot of money. What's the alternative? They may not have an alternative other than to renovate their house or have 4 kids in a bedroom. That would increase flow if they went from 3 to 4 bedrooms.
Yep.
And my thought process was I didn't have any basis to say the 20% other than it should probably be more than a repair, since they are adding to the house.
I'm almost okay with making it, are you, so you're making it, yeah, I just hesitate with it because there's so many factors of what they're doing, when someone adds a bedroom and a 2-car garage to the house, well, 2-car garages are nice, but if you're gonna get a variance for the septic because you can't afford it, you shouldn't be putting the 2-car garage on. I mean, that's just my thought process. So I'm explaining this so you understand where I'm coming from. And but I get what you're saying too. I'll also have the young family that's just trying to put a bedroom on. So how do you balance that?
You can say living space.
I mean,
So, or we can, so the garage, if they're adding a garage,
right, adds value to the house, and
Right.
then
we
they
can
need
have,
less of it, then they're getting closer to whatever percentage it is because they just added value to it.
well, I understand, but you could deduct the value that the garage added to the house. I don't know, that may be just getting too,
Yeah, okay. I just don't know how to make a balance between those that make the renovations just because they can and those that need to. And I don't have a problem with either one making the renovations.
Yeah.
I just don't want to have to reduce Title V.
none of this
If we can
reduce,
help it.
understand, none of this can reduce.
Right, okay, so we have guidelines that we have to stay in when they go, that they can do
So-
some things, but we have to have a reason to do it.
So in each case, the person requesting the variance must establish that a level of environmental protection that is at least equivalent to that provided under 310 CMR 15.
Okay, all right.
No matter what they're doing, they
Right.
have to provide the level of protection that Title V requires. They could just do it in a different way.
Okay. Okay. Alan, how are you on this one?
I'm reading it for about the 10th time.
Yeah.
Okay, so the repair one, I'm okay with, because that says the repair. We're not building onto the
Right.
house.
I think we're all okay with the first bullet point.
15%.
Yeah.
Yeah.
Well, I guess it's the, I don't know, I'm comfortable. I don't have a good suggestion for the one that's at the bottom of page 2, because, I mean, see, the 20% after the renovation is completed.
Now, I looked up the average home cost Well, I don't know what the average assessed home cost is, though. So that wouldn't be correct. I should just stop there.
Okay, so how about if, I would be more comfortable with it if the wording was of the value of the property before renovation versus after.
Before
No,
renovation?
no, that's where I'm having, I would not, it is,
See, I think that's opposite of what you were saying earlier.
Oh, you're right.
Yeah, no,
Okay, so
it's
probably the more money it
20%
is, yeah, you're right,
after the-
after is better.
the problem here is, it puts us into a speculative position, because we don't know what the assessed value of that house will be before the renovation.
So you have to go to the end of the. At the end, it says the person requesting the variance shall obtain a statement from the Sterling Board of Assessors documenting the value required in the above paragraph.
Okay, so someone else is going
Are
to.
they able to do that? I mean, we can put on a bedroom and,
Well, so when someone gets a building permit, the Board of Assessors are notified.
right,
And as soon as either the occupancy or the completion is done, the assessors reassess. I know, when I put my addition on,
yeah.
as soon as I was done,
But we're giving them the permit before they're finished, as I read this. We're giving this,
right,
yeah, and so I'm putting on a family room and a bedroom. Now, what they end up with and what they spend, it could be widely varying for the same type of building. I mean, you can have teak wood,
it's not what they spend, it's what the house is worth, right?
Yeah, but
the assessors have a formula. They don't just, they don't say, oh,
No.
he used, wainscoting instead of, they just say, you have the square footage, it's a family room.
Right, that's exactly getting to my point. But I put on a 2-bedroom addition to my house. I can build it and not spend a lot of money, or I could build it and spend an awful lot of money.
Yeah.
And we don't know what that money would be at the time we're issuing the permit.
No, but you would know what the assessed value of the house is.
But that goes back to what the assessed value of the present house is.
No, it says after renovation is completed.
But also, by that time, they're going to have to put in a septic system.
Right. So we're not saying they have to wait till the renovation is completed. We're saying that they have to go to the assessor's office and say to them, this is my house. If I add 2 bedrooms of such and such a size, what would my house be assessed at? Because that's a formula that they use. Now, if you're not comfortable with it, we don't have to do it.
I got to think this through more. I'm not comfortable with it, I guess I say that,
We can
because it
table that till
doesn't
next
tell
week,
you
too.
what the
I mean, next
cost
meeting.
of the,
In the meantime, I could talk to the assessor's office and see if they do that.
And I appreciate you putting the 15% and the 20% in, because I think we needed to do that.
I just thought if someone's putting an addition on.
Yeah, but I just think there had to be numbers for that to
I
cover
didn't.
everybody.
Yeah, I
So-
didn't have a formula for that. But this is something that I think we need to get
no,
done.
I think the idea behind it is
So-
good.
I think we got a little bit of a start there.
Yeah.
So.
And I
we can-
really appreciate having the new person get the handbooks and everything, because I didn't get that, and I wouldn't mind it.
So let's go back to the start of section 6, Board of Health. So that's us. Does anyone have a problem with A? It's pretty straightforward. So page 1.
No, sir.
Yeah.
So,
This documents what our responsibilities are. It's pretty straightforward, and pretty standard across boards. Except number 4 is actually in the statute. I don't know if people will aware of that, but it's actually in this statute for Board of Health, that we reorganized yearly. The only thing that I added was first meeting following the annual town elections, which makes sense, and that's been
Yeah, that's
tradition
the way
anyways.
it's always done.
Yeah.
And I just, on number 3, I mean, we record our meetings, so there's no reason, even if someone's not there, they can't go back and take notes and do things.
Just in case that's in there. I think we needed it, I know it's recorded, and I think we will always have an employee here doing it.
Yeah.
But I still think you need to have someone in, say we have an emergency meeting,
Right. Yeah,
Right.
no, that's true.
so
Yeah.
you need to have someone identified as the secretary, you know?
Okay.
Okay,
So we're good with A, we're good. How about B? Pretty straightforward as well, I think.
Yeah?
I've looked at number 4, and we have I would insert, because we have had in the past special meetings that are single agenda items, and I would insert every regular monthly meeting of the Board of Health, so have a public session. So it's clear that if we have an emergency meeting or a special topics meeting, we don't necessarily have to have a public session. Every
I
regular,
thought that was required to be allowed public.
It is not required, which is why
no, it's not.
it's not required. It's encouraged by the Secretary of State and the AG, both in their documents, they encourage it. But I understand what Alan is saying. If we have a special meeting, a single agenda, something comes up in town that we have to handle.
You don't want to be obligated to have a public session.
Okay.
I'll tell you that, though, if I'm the chair, I'll probably put it in there anyways.
Well-
But in a special meeting, we probably won't have anyone come.
Right, but you never know.
And
Well,
always with public sessions, you can put the rules in place beforehand. You have 3 minutes, you know, and
Yeah, no, I understand that,
But-
but I think we're
I
putting.
don't have a problem putting every
You'll
regular.
have one each month.
Yeah,
You can have more, but it
Right.
doesn't obligate us to do it every single time.
right. So I don't have a problem putting every regular Board of Health meeting shall include a public session.
And we just got a little spelling mistake down here.
You're way far ahead.
Oh, sorry.
So with that addition to B, are we good with?
Yes.
Yeah,
Okay. Okay, C. I tried to think of every document that I have used since I started this. And I think they're all very important in different ways, so
Yeah?
we good with C?
Yes.
Okay. D, where's my spelling error?
well, you got it 2 ways down here in the corner.
MAHP. Massachusetts is, it just belongs up here. I hit carriage return by mistake, I think.
All right.
C.
Boards.
So if you, Board of Health members are encouraged to use
Okay, so
professional
we're-
development opportunities
we're
offered
deleting-
by the
Yeah,
Massachusetts
so we're
Association of Health
deleting
Boards.
this thing.
No, it just goes here.
Oh, it goes.
It goes right here. It's the
Alright.
end of that sentence. See, I hit
Alright.
carriage return by mistake.
Okay.
That makes sense now?
Yeah.
Yeah. So D, we're good.
Yeah.
I mean, that's just, you know, I was never advised about this associate. I kind of found it on my own when I was fiddling my way through things, so. The MHOA is a good association. I've been to seminars by them. You know, I'd encourage people to join it. I mean, it's just something to let people know it's out there.
Yeah.
So it's not really, we've talked about F. We're tabling the second paragraph for now, so people can consider it. G, I just think is,
That's good.
yeah, H,
Yep.
I mean, okay. And I'd like to end there because it's 8 o'clock and we have an awful lot to do. It's a lot to contemplate in these things. So we'll continue with that going on. As I said all along, this is going to be a long process anyways. Okay?
Yeah.
So let's go on to new business number 8, ZBA special permits, 78 Worcester Road. Did everybody have a chance to look that over?
It's not in here, unfortunately.
No, that was emailed to you all.
Yeah.
Yeah, but we would like it, if even though it's emailed, put in here for when we're here. So-
Very well.
Okay, on things like that. The other thing I thought of,
As I recall, though, that was multi-pages. Do you want all of the pages? Do you want just the front cover page of the application? What would you like in there? My computer's restarting because of upgrades, but that was quite lengthy.
okay, the other thing, something like that is, whatever you have for septic information, because, we're saying fine, and I don't, you know what I'm saying? When we have some of these things, sometimes it might be helpful to know what is the septic before we just say okay, because it may be something that should be addressed.
Do you believe there's going to be an increased flow to that system with that? I think no.
Right.
I think probably less, if anything.
Okay.
So personally, I have no comment. I can't speak for the board, though. Do you recall it, Al? They're going to put they're
Yeah,
proposing to put an auto
They're selling cars.
Yeah.
used car
Yeah,
place
used
there.
cars. No, I have nothing.
Yeah, no, I was fine with that. I just,
Right.
but sometimes some of these things, we should get some septic information, so if it is going to make a difference to usage, we should know, because, I mean, it's one thing, we don't mind if you use it, but what is the septic capability of changing flow?
So do we agree that the Board of Health has no comment for the ZBA? Al?
Yes,
I agree.
I agree.
Want to make a motion?
I motion that we agree, we have no comment.
Second.
Motion second, further discussion, hearing none, that's our comment. No comment. Okay,
I will send something off to,
thank you. Gail,
Yep, okay.
floor is yours.
All right, now Dan Kapaska recommended that we implement the DEP checklist, which he brought up and gave to Dave, and I left mine there, and require all the information on it should be written on the plans. And every time they revise the plan, all that information has to go on the next revision. So all the information is carried forward, because we looked at a plan that had revisions, and all the information wasn't brought on the future plans. They just revised whatever it was and left all the information behind. And Dan has asked that when they revise it, they do the whole revision, and it's all on one sheet, and I think that makes sense.
Yep.
Why was that done that way, David?
what's that?
I don't think I was
No,
there
you
for
weren't
that.
here when he was looking at
So
that.
when they revised the plan, they gave you a new set of plans, but with only the revisions on it, instead of incorporating them into the original set?
Typically what happens is when we get a revised set of plans after the original comes in, we'll get in the title block, it'll say revisions, revision date, and they'll have small comments to what the revisions are. Those revisions will be picked up within the plan. Sometimes not all of the comments are as explicit or detailed out.
Okay.
Yeah, one of them had just like one part of it versus the other one, but anyways, but that was his comment. He wanted everything on the plan, on every revision. And he suggested that we added fees, because Dave has said there's people that send he has to send their plans back for 2 and 3 revisions. So one revision we send back is free. Next one we charge. And then if we have to send it back again, it should be a higher fee.
Yeah,
So we
and
train
those
these
are-
people to do it right the first time.
And what you're talking about, Gail, is not revisions to the plan, but you're talking about corrections to the plan because they didn't put information on there that belonged.
Correct.
So that's different than a revision is when they, say they start digging for the sewer to come out and they hit a giant piece of ledge or something, now they're gonna have to revise their plan, right?
Okay, well,
Sometimes
he
it's
had
an
called it
as-built,
revisions. Well,
right.
he had called it revisions, so.
Okay, but I think we
Okay.
need to be clear. It's really what, we're correcting what they didn't put in there, I think.
Or will get changed. Or will get changed.
Are they things that you're telling them that you gave them what to do and they didn't do it on the plan, or?
Yeah, they didn't include something that was supposed to be in there.
Yeah.
The things that are in the plan are defined by Title V. So if they didn't put something on there and we have to send it back, I think the idea is we send it back once, do it right this time. And if we have to send it back again, then there's a fee added to it because it gets to be too much after a while. These are professionals, they should know, and they do it all the time. So, and I'm fully on board with that. I think someone who takes a little shortcut will not do that again after the fee gets assessed.
And he said all addendums should be cross-referenced on each plan. And I don't know. I
don't understand what he means.
I don't know. I was writing down what he said. And so I'm just assuming change. But he said that everything on the plan he gave you, the questions, have to be on the plan.
Yeah, it's a checklist.
The checklist has to be
Basically, a
written-
Title V checklist is
Right.
what he's given us.
And he wants the answers to that on that plan. Every answer should be
Well-
on that plan, he says.
Right. So if the plan is done properly, all those questions are answered on it.
That's correct.
And that's why I say professionals that are doing it right, they would answer all the questions on there.
Right.
And that's why I say when we have to send it back to them because they forgot something, then we give them the checklist. Now do the checklist too. And next time, give it to us the right way. It's a soft correction. And because the second time, it's going to be, now we have to charge a fee because you're taking up too much of our agent's time. He's supposed to be doing something else. So, but that's something that needs to go into this policy booklet that we're doing,
Correct.
you know?
Correct.
So obviously I didn't have time to do that, but.
Oh, no, you got
Okay.
a lot done, so.
So why don't you keep going, because it's getting late.
Yep, and the other thing, he recommended we change our application for septic haulers. He wanted us to ask, how many septic systems did you pump in Sterling last year? He also wanted us to ask addresses as well, but the office didn't think that would be practical.
I think that's a lot, personally.
Yeah.
I think we start off with just putting in there, how many did you pump? If they say 0, well, why do you want to, right. So
Well, he put add a blank for just hauling septic through town.
Say that again?
He suggested add a blank for just hauling septic through the town.
yeah, I understand where he's coming from because that's part of in Title V, that's part of the septic haulers, in the septic haulers section. I truly believe that's one of those things that, as a board, we can never enforce.
Mm-hmm, right.
It's there, and really what's going to happen is, the only time that's ever going to come into play, the only scenario that I can think is if some septic hauler rolls their truck over on Main Street and they don't have a permit to haul through Sterling.
Right.
They picked it up in Clinton and they're on their way to Leominster or something.
Yep.
Or West Boylston, because they wouldn't be on Main Street. But otherwise, you don't know how many trucks drive down 190.
Oh, yeah.
Technically, according to that regulation, they would all need a
Right.
permit through us.
Yep.
So I'm not so.
I'm not saying it's practical, I'm just telling you what he said, okay? And the other thing he suggested is add a fine for pumping without a permit.
that would have to be a regulation, and we'll have to look at that down the road, but I agree with that.
Yeah, I do too.
And it should be something that stings. It should be worth it for them to come and get their permit, rather than try to pump without.
It should be
Well,
more than
yeah.
it costs to get permitted.
And you,
Yes.
if they block at paying, they don't get a permit for the next year. I mean, you got a lot of leverage.
Yes, yeah. Yeah, so that's good. Okay?
Yeah.
Anything else? Any questions?
That's about the main things, yeah.
No.
Were you going to do anything about changing the form that goes out to the haulers? Because that's going out beginning of, I think, the beginning of November.
So soon,
Okay.
yeah. Would the board vote to allow me to speak for the board as far as the changes to the haulage permit?
Yeah.
And just that, we'll put these additions on what we said. So, okay, we need to do it formally.
I motion that we let Rich represent the board on the changes for the haulers.
Second.
Any discussion? Hearing none, all those in favor?
Aye.
Aye. Okay, so I'll come and work with you guys in there, and we'll get that.
You should have a copy of that already.
The haulage permit, yes, yeah. Budget discussion, David.
So our budgets are due January 10th, 2025. We typically start the process next month with getting stuff together as far as our budget goes. In your packages, you all have a draft template. There's no numbers been established for the fiscal year 26 in there, but there is that form that we typically use. So I would expect that probably next month, we'll have some discussions on that, and then into December, we should be able to finalize that in our board meeting so that we could submit that for its deadline.
Okay. It's in there.
It's in here, number two.
It's under David's number
It's in the
2,
David stuff, right? Okay.
right?
That's what you're talking about.
Or is it, no, it's under,
It's under number 10.
Oh, okay.
yeah.
And the board should recognize that we both do Board of Health and Animal Inspector budget. Okay, so you'll see two different budgets, budget sheets. I have not heard yet from the Board of Selectmen on what any recommendations they'll have moving forward. As I said, it's still a little early, but they'll be working on that, I would assume.
Okay. And nothing from the finance committee?
Nothing yet.
Okay. Any other questions on the budget? All right, public session. Okay, nope. None. Future agenda items, if you have them, send them to David, as always. I encourage you guys to add things. And our next meeting date,
November 14th is our traditional second Thursday of the month, unless there are any objections.
it's good for me. November 14th.
Okay, I may need to be Zoom, I may not, I don't know.
Okay.
Because it looks like they're telling her she's going to have her baby earlier. So if she has her baby in October, I may be up in New York by then.
I thought she was coming home.
She is home, but she's only going to be home for a week, and then she's going to go home. And the deal was I was going to go home, go to
All
her
right,
house.
well, we'll do what we have to do.
Okay.
We'll put you on the big screen there.
Oh, great.
Okay. All right, any other comments from the board? Elaine? David? Okay. I have a motion to adjourn.
I move we adjourn.
My second.
There is no discussion. All those in favor?
Aye.
Aye.
Thank you, everybody. I know it's long. I appreciate it.